Hey everyone, today we are going to discuss about nursing diagnosis and care plan for schizophrenia. First, we will see what is schizophrenia. Schizophrenia is a very severe psychiatric disorder that affects a person's ability to think clearly, connect with reality, and function emotionally or intellectually. It often involves withdrawal from reality, disorganized thinking, delusions, and hallucinations. Symptoms are grouped into two main groups. They are positive symptoms and negative symptoms. Positive symptoms include hallucinations, delusions, and disorganized thoughts. Negative symptoms include lack of motivation, reduced ability to feel pleasure or anhedonia, and minimal speech. So it is a psychiatric condition that affects the person's ability to think clearly and connect with reality. According to the Diagnostic and Statistical Manual of Mental Health Disorders 5, DSM-5, two or more of the following symptoms must be present for the significant portion of time during a 1 month period, which include delusion, hallucination, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. If these symptoms are existing for more than 1 month, that person is considered as a schizophrenic person. Etiological factors. There are mainly two etiological factors for schizophrenia. They are genetic factors and perinatal factors. The genetic factors includes your parents or the first degree relative. The likelihood of developing schizophrenia is higher among biological relatives than the adopted relatives. If both parents are affected, the risk of their children increases to 40%. If one parent affected, 10% chances are there. Perinatal factors. Pregnant women who experience malnutrition or certain viral infection may have higher likelihood of giving birth to children who later develop schizophrenia. May or may not, guys. This is not the compulsory thing. Obstetric complications have been linked to an increased risk of the disorder, and also child born during winter months may also have an elevated risk of developing schizophrenia according to studies. This is not the exact etiology I'm saying, and these are all just risk factors. Then there are different nursing diagnoses. So based on the priority, I've given some nursing diagnoses here. Among that, first one is impaired verbal communication related to thought disorganization as evidenced by difficulty in expressing thoughts, incoherent speech, or inability to communicate. So communication problem is the first nursing problem. So based on that, I prepared this nursing diagnosis. Impaired verbal communication related to thought disorganization as evidenced by difficulty in expressing thoughts, incoherent speech, or inability to communicate. So what could be the goal? The patient will demonstrate improved communication skills by engaging in meaningful conversation and expressing needs effectively. That is the goal. Now we will see the interventions of planning. First intervention is always do history collection and mental status examination. After that, you can add all these things. First one, establish therapeutic rapport and trust. For that, approach the patient with calm and non-judgmental manner. Use active listening and validate the patient's feelings. Maintain consistency in caregivers or the nurses or the doctors to promote a sense of security. Then, monitor and manage symptoms or assess the symptoms. Observe for patients of disorganized speech or thought blocking. Use short, clear, and simple sentences when communicating with the patient and provide regular feedback to the patient to encourage communication. Then, provide education and support. Educate the patient on the importance of verbalizing the feelings and thoughts. Also, encourage the patient to participate in all kind of activities, especially group activities and interactions. Then under this, next planning is collaborate with interdisciplinary team. Include a speech therapist or counselor for communication that is depend upon the situation. Then report progress and challenges to the team during the care planning meeting. So these are all the planning or intervention you can do for impaired communication to maintain the communication. Then next is risk for injury related to delusion, hallucination, or impaired judgment as evidenced by reported auditory hallucination, commanding harmful behavior or unsafe action. Basically, the patient will show delusion or hallucination, that is a major symptom of schizophrenia. So this can lead to injury. So you can write the nursing diagnosis like this: risk for injury related to delusion and hallucination, or delusion or hallucination, or impaired judgment as evidenced by reported auditory hallucination. Then goal: the patient will remain free from harm, and identifying the strategies to manage delusion or hallucination safely. So under planning or intervention, you can write this planning. First one: always do history collection and mental status examination. Then ensure a safe environment to the patient. For that, you can remove all the potentially harmful object which is there nearer to the patient environment. Then assign a room close to the nursing station for a close observation if it is possible. Then monitor and manage symptoms. Regularly assess the patient's thoughts and perception of reality. That's very important. Then administer the medications as per the doctor's order, and also check the side effects of medications. Then collaborate with the interdisciplinary team again. With whom you can collaborate means with psychiatrists or therapists you can collaborate. Obviously you are collaborating with them and you are implementing their plans also. So work closely and inform them, record them, and develop individualized care plan to address specific risk. Then next one: disturbed sensory perception. That means again auditory and visual perception related to altered neurological functioning as evidenced by reports of hearing voice, seeing things that are not present, or misinterpreting sensory input. So this can lead to risk for injury. Disturbed sensory perception. And the goal is the patient will recognize hallucination as a part of their illness and use coping strategies to reduce their impact within 1 week. So it is not an easy thing. It takes some time also, some time. Then interventions include establish trust and therapeutic rapport. That's very important. All the mental health care plans or mental health nursing care plans, and especially this type of condition like schizophrenia and all, the first and the foremost plan is establish trust and rapport with the patient. That's very important. For that, you have to validate, you have to accept the patient feelings without reinforcing hallucination. For example, you can say, yes, I understand this feels real to you, but I am sorry, I do not hear the voice. So you have to validate the patient feeling rather than saying, no, nothing is there, there's no voice, like that. Don't shout on patient. After validating, accepting, just reinforce the patient. Then monitor and assess the intensity of hallucination and identify the factors which trigger hallucination. Then use grounding techniques like activities to encourage reality orientation, like activities, puzzles, mindful exercise, etc. Then administer medication as per the doctor's order. Then provide education and support to the patient to manage hallucinations, such as listening to music or engaging in activities. And this can change the patient to some extent, not completely, but to some extent. Then collaborate with doctors, psychiatrists, and also document everything. Also, involve the family members in the patient's care plan to provide additional support. Then, self-care deficit related to impaired cognitive functioning and lack of motivation as evidenced by poor hygiene. And as a result of hallucination, delusion, impaired communication, definitely the patient will lose the balance, and that can lead to self-care deficit. So you can write that nursing care plan also. Self-care deficit related to impaired cognitive functioning and lack of motivation as evidenced by poor hygiene and inability to perform ADLS, that means activities of daily living. And what is the goal? The patient will perform basic self-care activities with minimal assistance. Assistance definitely we have to give, but with minimal assistance. Interventions include assist with daily living activities to provide positive reinforcement to the patient. So for that, you can do one thing, that is break down the long task or big or complex tasks into small tasks. Then provide education and support. That's very important, especially to make the patient to understand the importance of ADLs. That means activities of daily living. Teach the patients about the importance of maintaining hygiene. Okay, they have brain, they can understand everything, schizophrenic patients. So whenever their mind is free, okay, that time So just tell them, this is the importance of hygiene, maintaining hygiene. If you are not maintaining, that can lead to further complications. Then encourage the use of visual reminders or written instructions. Sometimes they may forget the things, so we can give some visual reminders or written instructions or alarm or anything to promote that independence. Then ensure safe environment to the patient and make them happy, make them safe, and arrange personal items which is nearer to the within the easy reach to support self-care efforts. And also make sure that the patient is not having any suicidal ideations and kind of thing. Then collaborate with the doctors, psychiatrists, therapists, and also definitely you have to discuss the progress and challenges during the team meeting to adjust the care plans. So these are all the nursing care plans and nursing diagnosis for schizophrenia. So only the major care plans and nursing diagnosis I have had. Along with that knowledge deficit also you can add. So that's it guys. Hope you understand. So next time we'll come with another nursing diagnosis and care plan. Thank you. Bye bye.